Welcome back to my channel. I'm Dr. Kikuchi. I'm a medical doctor who started in Japan. I conducted a lot of research, educations, and consultation on stuttering. I'm going to share stuttering information on this channel. If you are new here, make sure you press that describe button. Today's topic is social anxiety disorder with people who stutter. Adolescents and adults who stutter often find that others underestimate their problems. People who stutter may be able to speak seemingly fluently because they use techniques to hide their stuttering. However, recent study reported that 40% of adult stutters have social anxiety. Many of problems of stutters who can speak fluently are often due to social anxiety. People with stuttering and social anxiety experience extremely anxiety and fear. When speaking in front of many people or in social situations, in addition to this, they experience excessive autonomic symptoms such as heart palpitations and sweating and blushing, tremors and nausea. Social anxiety disorder occurs in teenagers. Depression is said to be a complication in 20% of cases of social anxiety. When social anxiety disorder is combined with depression, the suicide attempt rate is 7%. Therefore, social anxiety disorder should not be ignored. Why do so many people who stutter develop social anxiety? I will divide speech station into three categories: before speech, during speech, and after speech. Before speech, there is anticipatory anxiety and sympathetic nervous activation. People who stutter say that these are painful. During speech, they use pillars, mask moments of stuttering are replace words, switch the order of words, and avoid situation to self-manage. After speech, they feel shame, isolation, guilty, and hopelessness. And also from their bring experience, they come to believe that stuttering is a bad matter. From these vicious cycles, they develop social anxiety disorder. Now I will explain the treatment and prevention of social anxiety disorder. I explain to stutters that you are not alone. I tell them they do not need to feel shame, isolation, or guilt. I like the sentence, you are not alone if you stutter. Of course, winning preparation is a must. I tell them about fluency building method and encourage them to expose themselves to less anxiety provoking situations. People who suffer from the gap between their ideal and reality. Often the person is hardest or starter. He the person themselves. For this reason, I encourage people live this they are stuttering before they speak. Stuttering disclosure is not only effective for the listener, but also the stutterer himself. It takes time to treat social anxiety disorder. However, stutters who have successfully treated their social anxiety are happy with their increased range of activity. There is evidence that self-help groups for people who stutter are helpful in treating social anxiety. It is very important for people who stutter to be able to connect with many other people who stutter. This is a summary of today's topic. There are two types of problems that people who stutter have. Stuttering itself and social anxiety. Social anxiety can lower the quality of life of people who stutter. Please pay attention to the problem that people who stutter have before and after they speak. Thank you very much for watching this video. If you are not subscribe my channel, there is a red button down below and hit subscribe. So will you see you in the next video. Bye.